If we just start with the statistics then, first of all, we know that there's been a 34% rise in mouth cancers in the last decade. Can I just get your reaction to that?
Mouth cancer rates have been rising now for the 22 years that we've been running the mouth cancer action campaign. They've gone up more than 50% during that period. So at 34% in the last 10 years, the rate of increase is perhaps slowing down a little, which is what we would expect when we're seeing the major risk factors of smoking decreasing and HPV vaccination beginning to come into play.
Why do you think, though, that numbers are still going up?
Well, I think it's a question that the main risk factors for mouth cancer are smoking or tobacco use in all its ways, so ethnic chewing tobacco as well. But the main age group that's affected tends to be the over 65s. And as a result of that, we're looking at the tobacco consumption, the excess alcohol. Excuse me. We're looking at the tobacco consumption and the excess alcohol from many years ago, really causing the effect in the increase of cancers today. HPV, the same virus that causes cervical cancer, was also implicated in mouth cancer around 15 years ago. And here we're seeing a slightly younger age group. But hopefully now, with vaccination having been in for girls over the last 12, 13 years, and for boys over the last 3 or 4, we will start to see those rates decreasing.
Do you know, when I read the press release and I saw that HPV was a cause of mouth cancer, I had no idea. Do you think a lot of people are in that boat as well? Is that one of the kind of more unknown causes?
Absolutely. And as I say, it was really only discovered as a link about 15 years ago. We were seeing a number of young patients with no apparent risk factors developing mouth cancer, couldn't really work out what that was. And the missing link proved to be HPV. And these are cancers that affect more towards the back of the mouth, into the throat. So they're ones that are quite difficult to spot. There's a little bit of good news here, though. With treatment, they tend to react rather better. So fortunately, the younger people that are being affected probably have a slightly better outcome.
Talk me through then some of the signs and symptoms of mouth cancer, because I think, a lot of people definitely aren't aware of them. What are some of the more common ones and then some of the more unknown ones that people really need to be aware about?
What we really need to look at here in the mouth and get people to be self-aware, we're not going to the dentist as frequently as we did. Dentists actually look for the signs and symptoms and the health of the soft tissue as part of a routine dental examination. When we're not going as often, we need to look for these things ourselves at home. So what we're talking about here is a mouth ulcer that doesn't heal within a period of about 3 weeks. Any unusual red or white patches in the mouth, particularly if they're changing size, shape, or position. And then also any lumps or bumps in the head and neck area. Now, these are all reasons for getting along to the dentist. And the campaign theme that we've used for many years now with our sponsors, Denplan, on this are, if in doubt, get checked out. The dentist's the place to get along to. We know now that it is quite difficult to get a dentist. So if you can't get along to the dentist, get along to your doctor. But don't leave it, because that early diagnosis can save lives. Unfortunately, over 3/4 of mouth cancers actually present at stage 3 or stage 4, where the prognosis is nothing like as good. So that early detection really is key. Some of the more unusual things, persistent hoarseness, things like that. So really be aware of any changes in that head and neck area. And if you're doubtful at all, all the oral surgeons that deal with these conditions would much rather see a patient and say there's nothing wrong, to catch that case early, than see people coming and needing extensive treatment as a result of preventing late.
You mentioned there how key dentists are in all of this. We know that it's very difficult to get a dentist appointment at the moment, but two as well, the cost of living crisis is meaning that people are really struggling to afford to maybe pay for a dentist appointment, or pay, to get checked out. Is that a concern for you?
It is a real concern. I mean, we're really concerned about the crisis in access to NHS dentistry in particular. It does seem as though government is just prepared to let it die on the vine. There's words spoken both by Rishi Sunak as new Prime Minister in his bid for the leadership earlier on that dentistry was important and he was going to prioritise it. The previous Health Secretary was equally including dentists, but we see no signs of anything being done. It takes 5 years to train a dentist, and the longer we leave increasing that training, the worse the problem's going to get. And I don't think, like other areas of the health service where we hide behind recruitment from abroad, that this is really going to work in dentistry, because there are so many barriers to foreign dentists actually coming to work in the UK. So real issue there. Cost as well. Obviously, clearly becoming much more of a problem. We've always been concerned that whilst the key message for us for this campaign is to go along to the dentist and get checked out, we realise there's a financial barrier there. So many people will be left with no alternative but to go along to their GP.
Is there help for people who, might not be able to afford to go to a private checkup if they can't get onto an NHS list? Because I know around me there's only one NHS dentist that's taking patients, and there's a huge waiting list. So I've had to pay to go private, but a lot of people can't do that, and they may need help from a dentist. Is there charities or other help that they can get to be able to see somebody?
It's a real challenge because, as you say, this is a very widespread problem. I mean, you're lucky that there's one dentist in the area that's accepting NHS patients. In many areas, that just isn't the case at all, and it's virtually impossible to find one. I think, one, you've got to be prepared to be persistent, to ring around, use NHS 111 and the online Find a Dentist service, but it is really challenging. And in terms of cost, if you're on any form of benefits, then it's likely that your treatment is free. If you're on a low income and having difficulty in paying, then there's also a form that the dentist can give you to apply for relief from the costs. But it's still going to leave a lot of people in the trap of making a decision, when we've got inflation at the rates that we have, between heating their house, feeding their children, and having dental treatment. And we know which ones are going to come first.
Think you so much, Nigel. I think that they were all my questions. Was there anything else that you wanted to add at all that we didn't cover, or do you think we kind of covered everything?
I think we've covered everything, unless you want a website for people to go to.
So what I'll do is I will sort out an article, and I think we have, from the press release that we got, I think there was a link to the website. Good. So we've got all that which we can sort. Yeah, thank you so much for your time. I really appreciate it. And just before I let you go, I'm going to stop the recording and just make sure that that's all started to save. Okay, perfect. Yeah, that's all saving for us. So yes, thank you so much for your time.
Pleasure.
All right, take care.